Welcome, everyone. I'm Bob McDonough from Aetna. I want to welcome you to the second half of today's meeting. We're starting off this portion talking about reimbursement issues. In organizing the conference, usually these conferences, the reimbursement issues kind of come at the end, sort of thinking about things in terms of the sequence of the development of a product or a test. It's usually sort of the last step. And we thought that it might be better to put the reimbursement issues a little earlier in the agenda so that, well, first off, that people will be able to hear what's to be said about that without everyone having to run out and catch their flights. But also because the reimbursement, as well as the regulatory, are going to be issues that might frame the types of studies that may need to be done to be able to meet the needs of the clinicians, the patients, the guideline developers, the payers, and the regulatory process. So today we have two speakers that are really at the forefront of evaluating and having to create evidentiary standards for reimbursement. We have Dane Dixon from Palmetto, who is going to be really sort of the focus, where they're going to be focusing on many of the new molecular diagnostics. And we have Dr. Donna Messner, who's Vice President from CMTP, who's getting some of the perspectives of the payer and multi-stakeholder groups together to really better define what everyone wants to know is what do payers and guideline developers, what types of evidence is needed. So we'll start off with Dane Dixon.